Welcome to Insight on Eye Health, a holistic look at cataracts. On today's show, we'll be featuring Optometrist Dr. Teske and Ophthalmologist Dr. Dean Smith, along with an impressive lineup of professionals to bring more depth to this topic. We've got a Registered Dietitian, a Naturopathic Doctor, a physician who specializes in hormones, and even an investment advisor. So stay tuned, because we've got a great show coming your way. Hi everyone, and welcome to Insight on Eye Health, a holistic look at cataracts. My name's Margaret Wallace-Duffy, and I'm very excited to have sitting next to me my holistic optometrist, Dr. Teske. Welcome, Dr. Teske.
Thank you, Margaret.
So a few months ago, I was sitting in your office having my eyes checked, and I have huge respect for the way in which you practice. You're really holistic in your approach. And I leaned over after my exam and said to you, I'd really love to produce a show all about cataracts and make it holistic, and you jumped at the chance. What's our goal in this project?
So I think we share the same passion, Margaret. Our passion is education. And we would love, with Insight on Eye Health, to empower patients to have tools in their toolkits to keep well and be well, and part of their eye health certainly will benefit from the rest of their body being healthy.
And that's what, you're so right, we really do resonate when it comes to that approach. And on this show, we are truly going to take a holistic look. We will cover, of course, everything about cataracts, but we're going to look at the impact that nutrition and hormones have, and even look at the financial impact that your eye health can have if we don't plan properly. It's important to you in your practice, and this is the way you work every day.
Absolutely. Optometrists, because we look into the eye, certainly can see a reflection of what's happening elsewhere in the body. So it's really important for all optometrists, and certainly for all healthcare providers, to link so that we can hopefully empower patients to be well.
You know, that's so true. And linking arms and holistically working together for prevention and improvement of patient outcomes is what we're all about. So let's talk about cataracts. Can you tell me sort of some of the signs and symptoms of the disease?
Absolutely. So a cataract is the natural clouding of the lens inside your eye. And often patients will end up in my office sensing change in their vision and diminishing of their vision, expecting that they need new glasses, when really glasses are not the answer at all. So often in early cataract, we can shift a prescription to temporarily help with early cataract symptoms, but really what they're sensing is night driving problems, halos around headlights, and glare is the most predominant problem.
And so what can we do about that in those early stages?
So certainly early on, if we can change prescription, that's helpful, and then premium anti-glare lenses are essential at getting more light through the lens, more light into the eye so the patient can see better. We have a device-filled world. We use iPads, iPods, laptops, computers, and all of those devices provide us with so much glare. Nikon has been instrumental at leading industry and developing blue light filters that allow us to be protected from glare. Cataracts are not the only cause of glare. If other ocular media, like the surface of the eye, the cornea, or the tear film is not clear, that will also induce blurry vision. It is important with cataracts to ensure that the surface of your eye is not dry, that the lids around the eye are clear and not inflamed, and all of those things help a patient see clearly.
We're back here with Dr. Teske talking about prevention and lifestyle in cataracts. Now, I know you are all about prevention. So when we're talking about glare, how can we prevent that?
You know, patients often sense glare for a variety of reasons, not only cataract. Glare is created when there's scatter of the light that is trying to get into the eye. and that glare can be created by a dry surface. So instead of being reactive to dryness, if your eyes feel dry, put drops in. Then generally I encourage patients to get up, brush your teeth, put a drop in every day. And in my office, my recommendation generally is high-low.
I know that firsthand because with my aging eyes and going through menopause so early, I was shocked to find out that I should be taking and using eye drops every day regardless. I didn't even have dry eyes. It's so important for eye health.
You know, we use lubricants to hydrate your skin and your hands and your face, but we really neglect our eyes. And we have such a visually demanding world. You know, we're using devices. Blue light is a reality, and it's important to shield our eyes from the effects of blue light. After cataract surgery, it's important that to benefit from the clear vision that removing the cataract has allowed, the optics of your spectacles will also provide you with clear vision. Nikon lenses give you those optics with their multi-layered coatings. Nikon lenses have UV filters on the back surface, which protect even more the eye from harmful rays.
So one of the challenges after a patient has had cataracts removed is we hear that everything is brighter, so a lot of light sensitivity, and you know, a lot of there's potential for a lot of UV to get in there because the natural lens in your eye is gone. So having a very high quality pair of sunglasses is really going to help with enhancing the natural quality of your vision, letting light in while letting no UV rays get back there because that lens is gone. So Maui Jim does a great job of that because you have lots of color options. The clarity of the lens is beautiful. The lens has a mirror on the top and the bottom so that when you put that sunglass on, it blinks for you. So you put them on, your eyes are nice and happy in that lens. And having that 100% UV protection really helps slow down diseases like macular degeneration.
We'll be right back and we'll hear from Dr. Hilary Webster, Naturopathic Doctor, to talk about how naturopathic medicine plays a role in your eye health.
So my name is Hilary Webster. I am a naturopathic doctor and I practice at Wallace for Wellness. I practice drugless medicine and I'm working to heal the root cause of conditions, common health complaints, and we're working to improve people's chronic health concerns, and the eyes are certainly a part of the whole body. We practice holistic medicine, so we're looking at all of the patient when we look at a particular concern. So I've treated patients with eye concerns before, and often they're related to other conditions. I've had to talk to a patient about smoking and the role of oxidation in eye health, for example. So I see a lot of nutritional deficiencies in my office, and B vitamins are used a lot in the body for a lot of different processes. B2 or riboflavin, which is actually a very important B vitamin for energy production all throughout the body, but it's also really important in antioxidant function, which is so important for the eye and for eye health. And so many conditions for the eye, you need antioxidants, and riboflavin is connected very closely to glutathione, and glutathione is one of the most powerful antioxidants in the body. So we would think of riboflavin for cataracts, for example. So if I were treating an inflammatory eye condition, such as blepharitis, I would certainly use the Dolphin or the microcurrent point stimulation device in local points around the eye. For so many people, when they're in pain or when they have inflammation, they're in fight or flight mode and their sympathetic nervous system is upregulated. So microcurrent, what it helps to do is to downregulate the nervous system, put you in rest and digest mode, and to decrease inflammation using the power of acupuncture points as well.
It's an honor to be sitting here with Dr. Dean Smith, ophthalmologist and co-medical director of TLC Mississauga. Welcome to Insight on Eye Health.
Thank you, Marg.
It's been a pleasure being here today in the clinic with you. And when we're talking about cataracts, and when a patient is referred to you, what does that experience look like for a patient? What can they expect?
Well, so the patient usually has a problem. They're usually having trouble with their vision, and they're referred usually by their own eye doctor. And they come to the clinic, they get some testing done, I examine them, and then basically I inform them as to their condition. So I tell them how bad their cataracts are. I tell them about any other eye problems that I see, particularly things like dry eye or macular degeneration. And then we get into a discussion about what we're going to do about it.
Now, I can imagine that once you hear that there is a cataract and perhaps that there's a surgery pending,
Right.
fear sets in.
Yes.
How do you eliminate some of that fear for your patients?
Well, the most important, well, there's a couple things. First of all, the procedure is really painless. People don't like the idea of having things done with their eyes, but it really is painless. It's quick, and they're sedated. There's another doctor, an anesthesiologist. They have an IV going, and we can give them as much or as little as they need. So
that's comforting.
Yeah.
Now, when it comes to choices, I mean, there are many when it comes to an implant, for example. How do you help guide and educate your patients so that they make the best decision for them and their lifestyle so that they get the best outcome after their surgery?
Well, there's a couple parts to that, Mark. First of all, you look at what their vision has been like. You know, what sort of correction they've been wearing, whether they're nearsighted, farsighted, astigmatism, and so forth. And then you inform them about what types of corrections can be done. So simple distance vision correction is usually pretty straightforward. Most people can get that. But there are ways of giving people both distance and some near vision now.
Oh,
so
yeah. That's fantastic. And can you briefly speak to coming to a private clinic like you have here at TLC versus the other options for patients? Can you speak to that as well?
Sure. So all of the options for patients these days are quite good. So the surgeries that are done that are funded by the government are very effective, and they get all of the benefits of the most recent advances in the procedure and so forth. So, and generally with that, we can give people pretty good distance vision correction, or if they were nearsighted to start off with, a good nearsighted correction. Now, some people, whether they have astigmatism or whether they want both distance and near, that requires additional correction. And so that's why clinics like this offer additional services, basically additional testing, special feature lens implants, additional follow-up afterwards. Sometimes people need a little tweak or a touch-up treatment afterwards. So you have to be able to offer all of those things in order to offer the upgraded service.
Well, thank you. I know that our team has just been amazed at watching you work here in your environment.
Well, thank you.
And I know that all of our viewers at home will be grateful for the education that you're sharing and the amazing work that you do. Thanks for joining us.
Thank you very much.
So you want to choose a high quality lens. So Maui Gym has a variety of different color of lenses depending on what your activities are. A gray lens allows you to see the true colors. A brown lens provides more contrast, as well as a rose colored lens would do that. So depending on what your activities are, whether you're wanting to see the lay of the land for golfing, or some tennis players like to have more so a brown lens versus the gray lens where it lets you see more of the intense colors.
You may not be aware of the role that nutrition plays in your eye health. We caught up with Amy Hayes, Registered Dietitian. Let's have a listen to see what she has to say.
Hi there, my name is Amy Hayes and I'm a registered dietitian. When it comes to our eye health, nutrition plays an important role in the prevention of any sort of eye-related illness or disease. One of the most important nutrients for our eyes is antioxidants. Antioxidants protect our eyes from the damage caused by light, air pollutants, cigarette smoke, and these are environmental toxins that we can't necessarily control, so including a good amount of antioxidants in our diet is an important part of preventing eye-related diseases and illnesses. When it comes to antioxidants, there are a few that are particularly helpful for your eyes. Those are vitamin C, vitamin E, vitamin A, lutein, and zeaxanthin. Vitamin C is found in foods such as citrus fruits, broccoli, strawberries, and red and green bell peppers. Vitamin E, on the other hand, is found in different nuts and seeds and wheat germ. And vitamin A, of course, is the one we know most as being helpful for eyes, and that's found in orange vegetables such as carrots, squash, and sweet potatoes. Lutein and zeaxanthin are found in leafy greens such as spinach, kale, collard greens, and turnip greens. And an interesting fact is that cup for cup, kale has 7 times more of these antioxidants than spinach. Another way that your diet can assist with eye health is by reducing the inflammation in your diet. And that's by including foods that are anti-inflammatory, such as omega-3s, healthy fats that you find in nuts and seeds and avocados, for example. And then, of course, avoiding the foods that cause inflammation, such as sugar, processed foods, and highly refined carbohydrates. So I have 5 tips to incorporate all these nutrition strategies into your diet to help with your eye health. Number 1 is to have a handful of nuts and seeds every day, a small handful. Number 2 is to have 1 orange and 1 green vegetable every single day. Number 3 is to have 2 servings of fatty fish each week. Number 4 is to replace all refined grains with whole grains. And number 5 is to include a fruit or a vegetable at every single meal.
Dr. Christy Prouse from the Institute for Hormonal Health shares her expertise on how hormones have an impact on your eye health.
I'm going to be speaking today about dry eyes, and in fact many times it can be related to hormonal conditions, not only diabetes and thyroid disease, but in actual fact sex hormone imbalances, and that includes estrogen and testosterone, which we typically associate with the perimenopausal and postmenopausal time frame. Now interestingly, about 60% of perimenopausal and postmenopausal women will experience dry eyes, but only 16% of them are actually aware that it's hormonally related. Estrogen and testosterone actually have receptors in the cornea and the meibomian glands, so it makes sense that if there's a sex hormone imbalance that it would impact on eye function. It would follow then that if a sex hormone imbalance can create or aggravate dry eyes, that rebalancing these hormones would help to alleviate or resolve these dry eyes. Now in my practice, I am treating perimenopausal and postmenopausal symptoms, and those symptoms can be quite varied and includes dry eyes. And what I have noted is that with nutritional changes and dietary modifications and supplements, and the use of bioidentical hormone replacement therapy is that dry eyes actually resolve along with all of these other symptoms. The scientific literature, however, suggests that hormone replacement therapy in actual fact can aggravate dry eyes. What I say to that, though, is it is important to distinguish between whether bioidentical hormone or conventional hormone replacement therapy was being used. The difference being is bioidentical hormones match what our bodies actually make, and conventional hormone replacement therapy are synthetic and do not match what our body makes. This is one of the more common mistakes within the hormonal scientific literature. It is an area that requires future study. We've been learning about the importance of antioxidants with regards to eye health, but in actual fact, antioxidants are critical for general health as well. Historically, blood work was the only way to measure antioxidant status. Fortunately, there is now a non-invasive way of getting the same accurate information as we can get in blood work, and that's called the biophotonic scanner. It's a Nobel Prize-winning technology that basically emits a light that bounces off the carotenoids, which are the mother antioxidants in our skin, and is reflected back at a different wavelength to the biophotonic scanner. And you can get a measure of what your antioxidant status is. It's as simple as placing your hand over the sensor and getting your results within 30 seconds. It's quick, it's painless, and it's valuable information that you wouldn't otherwise have. Scores in the red zone are lousy, and generally these people are smokers and/or are obese. The orange and yellow zones are typical for much of the North American population and suggest that there is a definite room for improvement. Green is pretty good, and the blue or the gray zone is exactly where you want to be. I scan each and every one of my patients at the Institute for Hormonal Health, not only for baseline data, but also for objective measurement of improved antioxidant status over time. It gives us an idea whether the changes in unhealthy habits and dietary changes and supplementations to improve antioxidant score are actually having an impact, because otherwise we would have no idea what our antioxidant status is.
So Dr. Teske, does everyone experience a cataract?
Eventually, everyone will experience cataract. Not everyone needs to have them removed if their lifestyle isn't compromised, but everyone will have the lens inside their eye yellow.
Now, as our population ages, and it's doing that rapidly now, what about access to care?
For some patients who don't have the means to be able to be in a private clinic like this one at TLC, then it's even more important to be preventative in terms of monitoring cataract change and having yearly wellness checks with your optometrist, so that if they need an insured service, that we get them in the queue on time.
Thank you so much. We'll be right back here on Inside on Eye Health with Terry McIntyre, Investment Advisor. I'm passionate about investing in your health, so what better person to be sitting down next to than Terry McIntyre, Investment Advisor, to talk about this. Welcome.
Well, thank you very much. I'm so pleased to be here.
So Terry, I know in your practice it's very diverse and you do have all ages. How important is it for people to have a plan when it comes to their health?
Well, it's extremely important. It's one of the things that's missed a lot in our industry. People don't know what they're going to need. Things come up out of nowhere. You want to be able to do, well, not sacrifice anything, I guess, in your life, to be able to get the right thing for you when you do it. We look a little bit, I do anyway, look a little into family history. You might know what's coming along. And then we try to plan accordingly. There's no set numbers, but you really want to be able to have money there when you need it, because health problems don't usually sneak up slowly over time. You need it now.
And it's so important because we do want to plan to be able to golf and go on trips, but if our health is compromised, we don't have any of that. And in a society where we're tending to live longer, we want to live well. And I'm sure as an investment advisor, having a plan in place really takes off a lot of the stress, doesn't it?
Oh, absolutely. One of the discussions you have, and people say it all the time, he might have a lot of money, but his health isn't good.
Right.
Well, we want to see you be able to do the best for your health in every part of it. Right. So you want to be able to say, I'm healthy and I'm wealthy, but we want to be able to have that aside when you need it.
Absolutely, and to be able to make choices that you want to make for your lifestyle, for your health, because you have the financial means to do so. And of course, someone like you helps us walk down the path, linking arms together to be able to make those decisions wisely so we set ourselves up for good health.
Yes, exactly. You've hit it dead on.
Thank you so much for joining us, and we look forward to having you again here on WOW New Media.
Thank you. It was a pleasure.
Stay tuned, because we'll be right back shortly after the break.
So my symptoms on an annual basis were getting worse. I would get a new prescription every year for my glasses. Even with glasses, I had a blur, especially in my right eye. And driving at night was a little bit challenging, always a halo, a haze. I didn't realize there were that many choices until I sat down with Dr. Smith and discussed the different lenses that I could have transplanted. And so I chose my right eye is for distance and my left eye is approximately here for reading, which makes it easy for computers. But one of the greatest things after the surgery that I experienced was walking out, getting into the car, sunglasses on of course, and being able to see distance right away. And I found that blues and greens were so vibrant and bright. It was just incredible. I definitely recommend it. I live on the computer. That's what I do on a daily basis, being in real estate, and then showing properties and listing properties. And it's great just to have contact with people, not having to worry about wearing glasses all the time, because I could always read without my glasses, so I was taking them on and off and on and off. So just being able to read, seeing distance is great. So after the cataract surgery, I feel great, no issues, just dryness. So I put drops in every morning, and I'm fine throughout the day.
So we're back with Dr. Dean Smith talking about cataracts. Now, Dr. Smith, I'd like to speak about lifestyle and how cataracts can impact lifestyle, and then also, looking forward after the surgery, what should we be considering when we're making choices before surgery so that our lifestyle is going to remain as good as it was prior to surgery?
Obviously, the lack of vision and the declining vision can restrict people. So they go from a position of being somewhat disabled to correcting the disability, but then they can even go a step further. So we can enhance or improve their pre-existing vision. So what I like to do is find out from the patient what their visual demands are. So I specifically ask, so how much time do you spend on the computer? Do you play golf? Do you do a lot of very close work? Or do you do a mixture of all of those things? And usually from that, we can figure out what combination of lens implants will provide at least some of those needs.
And so is there a fee associated with that? It sounds like, to me, investing in your health is always what I believe in. And having a lifestyle as we age is so important. A good, healthy lifestyle is important. And these things we're talking about, golf and time with our family and hobbies, they're important to our mental health as well. So is there additional cost associated with further corrections or premium implants?
Well, there can be. And again, it depends on what the patient's needs are. If the patient doesn't mind wearing glasses for near, and they don't have other visual problems like astigmatism and so forth, then the insured procedure will quite often do the trick. But if they do have those problems, or they want less dependence on glasses, then there is a cost. It's basically cross the border into what we call refractive surgery, similar to laser vision correction, LASIK, PRK, that type of thing. Right. So in those instances, part of the procedure is funded, but part of it isn't.
So what you're saying is there are lots of options.
There is.
To maintain our eye health as we age and to allow us to continue to be on the golf course with our kids as we get older.
For sure.
Thank you, Dr. Smith, for your time, your expertise. It's been an absolute pleasure to have you on the show. We really feel privileged to have you with us today.
Thank you, Marg.
Thanks for joining us. It's been a great show. We'd like to thank all of our sponsors because without them, this show would not be possible. Now, if you'd like to find out more information about eye health, be sure to go to our Wow New Media website and follow us on Facebook and Twitter. Stay tuned because we've got more great things coming your way here on Insight on Eye Health.